Hi, I'm Luke, I'm the practice owner at Zest. So I'm just going to give you like a nice outline of how we work here, the sort of approach that we take, because it is a little bit different to other people, and we're proud of how different it is to other people because we really think that we're doing the right thing and we do get excellent results for people. So yeah, here's how we work here at Zest. We really do have a particular style at Zest, which is different to other people, and that is that we are utterly focused on trying to figure out the root cause of your problem. Now, you might just be thinking, look, I don't actually care too much about the root cause of my problem. I just want my pain to go away. And that's completely understandable. But even if you haven't considered this, you don't want your pain to go away and then just come back again, okay? No one wants that. As tempting as it is to just focus on people's symptoms and get them a good short-term outcome just to make them feel better at the time, if people's symptoms just come back again, then they end up in this kind of indefinite cycle of going to see the osteopath, getting a little bit of a back rub, getting a click, feeling better, then it comes back, then they go back, and it just goes on and on. There is a different way to approach things, and we unapologetically approach things in a how do we make you feel better now way, but also how do we work out what the root cause of this is so that we can administer treatment to that root cause to stop it coming back, and we can give you self-management strategies so that you can help prevent it coming back as well. And that's how we get the amazing long-term outcomes with people that we get here at Zest. So the way we do that on a first visit is it will seem like normal. We'll do a case history, we'll have a conversation with you and stuff like that, but we're going to deep dive just into a couple of other aspects that maybe you haven't chatted about with people before. We're really going to want to know everything from top to bottom as to what's going on. And then when we do our assessment, that's when we're really trying to figure out, okay, for example, if this is someone that's got neck pain, is it actually just the neck that's a problem, or is the neck compensating for somewhere else? If this is a shoulder problem, is it just the fact that the shoulder muscles are tight, or in fact is the shoulder compensating for the elbow? These type of things are really, really common that we see, because if you've got a muscle that's tight and it's painful, it's not just tight for no reason. There's always a reason why that muscle's overworking. If you've got a joint that's stiff, it's not stiff for no reason. There's a very good chance that it's stiff because it's having to do too much because something else isn't working quite right. And it doesn't take too long, but it is a really specialist approach that we take to understand why these things are happening, like I said, so that then we can do something to make it feel better. Okay, let's loosen the muscle, but instead of then just waiting for the muscle to get tight again, we can work out how do we improve your function as well, get the joints moving how they should, and then how do we give you the right strengthening exercises so that you can stabilize this area and prevent it from tightening up again. When it comes to treatment here with us, we've always got a really simple approach of sort of short, medium, long term, which fits into what I've just been talking about. And basically short term is always just going to be symptom relief, okay? So if you've got a trapped nerve, we've got tools to calm the nerve down. If you've got a tight, irritable muscle, then obviously we're going to get in there and try and loosen that muscle off. If you've got a joint that's locked, then we're going to free it off, either with a click or with a more gentle technique if you prefer. Once we've got you feeling better, then we're going to focus on your function, which is really kind of how you're moving. So that's when we're going to just broaden that scope, and we're going to look at the whole spine, and we're going to look at the whole pelvis and the hips. We're going to look elsewhere apart from where you've got the symptoms to make sure that everything is moving in the way that it should, because that's going to be the first step in preventing that symptomatic area from flaring back up. Last stage then is stabilization. So we don't give people strengthening exercises at the beginning of a treatment plan when they're in pain. And this is like the fundamental difference between what we do and what physiotherapists often do, especially NHS ones, which we hear a lot of complaints about, is that, if someone's got back pain, then yes, we all agree that you should get your back stronger. But where we really differ is that we understand that the timing is everything. If someone gives you strengthening exercises when your back is still painful, then it's just going to make your pain worse. So then you're going to say, okay, well, those exercises didn't work, and then you're going to stop doing them. And then your adherence to the exercise is bad. You don't actually ever get stronger. And now your back is just more painful than it was before. So the way we approach it is deal with the symptoms, get you in a better position where you're feeling better, deal with the function, get the movement better. And then when your body's prepared for it, then we give you the strengthening exercises, help you to stabilize the area, and then we work on prevention. We don't put prevention in too soon, because otherwise it just makes the symptoms worse. So in terms of how we approach a treatment plan at the clinic, we're not one of these clinics that's going to say we need to see you, twice a week for a year because we've done an x-ray and your spine's crumbling. Like, we're not fear mongers. We're not going to try and sell you something that you don't need. But the reality is that we do need to see people a few times to be able to make a difference. The way that a functional change works in the body is that it is essentially like a teaching process. Like, we're teaching your body to move differently. And there is, no other example of teaching really that occurs when you just teach somebody something once and then they remember it forever. It's you repeat the process, okay? So we teach the body how to move differently, and then it kind of tries to go back to how it was before, but then we repeat it, and then we give you exercises so that you can reinforce it, then we repeat it again, but we add something else in. And that repetition over time with us doing it and you doing it at home gets the really good outcome. So we are going to be looking at a treatment plan with you, because to have a start, end, middle, and give you prevention is going to require a little bit of a plan. But don't worry, we're not going to give you anything outside of what you need, and we're completely aware that it's not free to come here. So anything that we can make work for you in terms of like a financial solution to being able to pay for a small treatment plan, we're going to try and help you out with that in any way we can.